Hello, thanks for tuning in. I'm here today with my colleague Lisa Solis Delong, and super excited to talk to Lisa about her title and her role. So, CSO. Lisa, tell us a little bit about that.
So the title CSO is a self-appointed title, and it came to me actually at a speaking engagement. I was having a lovely dinner with some of the organizers the night before speaking, and the topic of spirituality came up, and I am very excited about spirituality and spiritual topics. So I shared some ideas with them, and before dinner was over, they appointed me my own chief spiritual officer, and the next day I was the chief spiritual officer of the engagement. And I really liked that. It really stuck, and I think it's important for all of us at some point or another to realize that we are our own chief spiritual officers. We attend to our spirit, and I think especially in healthcare, that's important. Plus, it's just kind of fun to be the chief of something.
Well, I love it because it's a title that so fully represents you, and almost on a daily basis, personally and professionally, I learn so much from you in that role. And that leads us nicely into something that's near and dear to both of our hearts, and that's an expertise, I think, for both of us in a different way, and that's communication. So talk to me a little bit about the why behind communication being so valuable.
Okay. So for me, especially being the mother of two sons with leukemia, I've had the experience of being on both sides of the curtain as a patient caregiver, and also as a professional caregiver. And so what it means for me is that, you hear things differently on when I was the nurse on the outside of the curtain, and, moving that aside, I came in with a lot of information and expectations of my own, and a preconceived notion of what a patient needed. And it becomes very important when you're on the other side of that curtain to convey your needs and really be heard. Because as medical professionals, very often our caregiving becomes very rote. We sort of we think, well, I've done this 1,000 times. I was a mother-baby nurse most of my acute care professional years, and so sometimes care becomes very rote, and you know what you're going to say, and honestly, and this is truthful. Had done it so many times. I would walk out of the room and forget, what did she say? Had the baby eaten? What was her blood pressure? Those things that become so routine that we're not really hearing, and that can happen in our daily role. And so for me, going back to the spiritual aspect of self, always checking in. I'm the chief of what I'm bringing into that space. And you're not going to be able to hear what a patient says unless you really are aware of yourself before you put yourself in that position. And patients have needs and circumstances that we may not be aware of. So when we come in open and ready and centered, then we're able to hear them. I had an incident when my son was first diagnosed. Justin, he was 5. And I've shared this at all of my speaking engagements because it really is very telling about how communication can affect an experience for a life, really. So Justin was 5 years old. I took him in to get his 5-year-old kindergarten checkup, and he had been a little pale for a couple of weeks and a low-grade fever that came and went. And I sat in the exam room waiting for the pediatrician to walk in, and he walked in, and the first thing, he looked at Justin, and then he looked back at me, and the first thing he said was, "You nurses, you know how to take care of everyone's kids but your own." Right? Which was, it was like a dagger to my heart at a time when I really needed cotton balls, And I love this man. I worked with him. I see how brilliant he is and was as a physician. And in that moment, he was not in his brilliance, And here at Short Group, we're here to help bring that up and bring that out. And so it all wraps into one big topic, really: communication, attending to our spirit, attending to the spirit and nature of our patients as well.
Right. Well, thank you so much. Thank you for sharing that story, and for another one of your expertises that I always learn from is always coming from your heart. So very much appreciate that. And thank you all for joining us today.